So welcome, this is the second video in our back care awareness week, and now we've talked about the acute phase. What do you do immediately in the hours to sort of day or so following that injury to the back? Now we're talking about going forwards beyond that. What do we need to be doing to make sure we encourage that healing process, make sure everything heals up nicely so you don't maybe feel better and then go back into a dip, back into a problem. Now, the first thing that we want to do here is actually make sure that we're doing some low stretches and exercises that are actually going to help reduce the tension. A lot of times when we injure this lower back here, and your belt sits around here, so it's the L4-5, L5-S1 segments that we've injured, you get a lot of muscle spasm in the glutes, in the hamstrings, and that causes these hips to tighten up. And that means that when we're bending, we can't quite bend from the hips to keep the back in a nice neutral position. Instead, these hips are nice and stiff and tight because of muscle spasm, and then you're bending with the back, making the problem worse. So the first port of call is going to be doing some remedial stretches, and that's stretching the hamstrings, that's stretching the glutes, that's stretching the calf set. So all these muscles aren't influencing that lower back and aren't limiting that range of motion in the hip. So the lower back can stay in a protected position as we're bending forwards, keeping that back arch nice and straight, nice and neutral, rather than having it flexing and forward bending to further compress and injure some of these structures. The next step is using a towel. We often recommend this to patients that have got some sort of disc-related injury or injured themselves, essentially lifting a box or some sort of lifting-based action, which has caused compression through the discs and leading them to get suffering problems. And often this can manifest as muscle spasm in the first instance. So just because you think, oh, I've just injured a muscle, it's only going on for a few days, don't assume that it's not something maybe related to the discs. And it can be a minor injury to the disc, but this one will help you. And that's using only for about 2, 3, 4 minutes at a time, getting a rolled up towel about the size of a foam roller and placing it just underneath that lower back about here. So it just creates that little arch and takes those pressure off those discs. You have your knees up, so your legs are up there and your feet resting on the floor, and that just creates this little arch through here to take some of that pressure off the discs. Be careful when you're doing this one, it will feel like a nice stretch through those discs. You might get a bit of an achy sensation at the bottom part of your lumbar spine, but you only stay there for a few moments. And when you get off, rather than twisting off, you just tip your whole body, boom, off the side. And if you do want any advice with this particular one, make sure you get in contact with us. Just ping our team an email at the Mayfair Clinic and someone will be able to send you a nice video of one of our team here doing that specific exercise, just to make sure you're getting off it correctly. And it's a fantastic one to just take some of that pressure off those structures that are trying to heal. Remember, everything we've talked about so far has been staying up straight, reducing inflammation down here, and obviously with today's video, keeping these hips nice and mobile. So that towel is restoring and holding this nice lordosis in the lower back to make sure we're not pressurizing these structures. And then the final one is starting to do some core engagement. A lot of people, if back pain starts to persist, and we're talking about the back end of the first week, we're talking about 7-10 days, they don't have the appropriate core stability. So some simplistic core engagement exercises to stabilize this section and provide your lower back with a little bit more protection and support while it's trying to heal are vital at this stage. And you want to do those, that's not sit-ups, that's not leg raises, that's not planks. It's simplistic activation exercises to make sure you're engaging these muscles around here to protect your back. And again, as with the towel example, if you want any specific guidance or advice on these particular exercises, contact the clinic, because one of our team again will be able to help you out by sending you just a short video explaining exactly how to do these exercises so that it's safe for you. And that just provides a little bit more support for your lower back. The final thing you can do, and this depends on the severity of symptoms for you, is a little bit of light cardio. We mentioned in that first video a little bit of walking around the house. Well, at this stage, as long as you're walking with good posture, a little bit of walking, maybe 10, 15, 20-minute walk here and there, just to keep this lower back section nice and mobile and continuing that icing that you've been doing in that first period to make sure that this section heals and inflammation doesn't get out of control. So that's the end of video number 2. Hope you found this one helpful as well, and stay tuned because we're going to start moving in the next videos into the exercise-based work. What specific exercise should we be doing, and how should we be doing those, and how should we be progressing those in the subsequent few days? Maybe you're feeling a little bit better in your back and you need to prevent this coming back in the future. Thanks for watching.